Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a How Do You Treat That episode today. For those who don't know, these are medical episodes. These are episodes where I bring a case to a specialist or expert that I admire, and I ask them, how do you treat these cases? Like, what do you look for? How can I raise my game? And the one and only vet eye guy, Dr. Sigmund, delivers. Guys, we're looking at the classic red-eyed dog today. That's right, you my red-eyed dog. This is a 9-year-old Shih Tzu that's coming in for a 2-month history of bilateral redness in the eyes. And I go straight to one of the masters and say, hey, how do you treat this? And we find an interesting case. And so we knock out your easy stuff and we wade into your more challenging stuff. And it's a really, really good episode that I think everybody who sees pets that have eyes should take a listen to. So I'm glad you're here. Guys, let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Sigmund. Thank you for being here, my friend.
Yeah, thank you for having me again.
I love having you on the podcast. I don't think that eyes get enough love. From me specifically, probably. It's just eyes are something. I don't think I'm alone when I say that eyes are scary. I think for a lot of practitioners, I think it's a thing that we had not minimal training, but we did not a huge amount of training in school. And eyes are something that I think I know the basics, and I've got the basics down to working out. But I feel like I'm out of my depth fairly quickly with in-depth eye cases, and so I want to be better. I want to be better, Alex. And so I have a case that I would like to run by you. And I think this is a pretty common-ish sort of case that people see, but I would like you to help me just walk me through how you'd work this case up and where your head would be at. Can we do that?
Absolutely. Let's do it.
All right, great. So I have a 9-year-old male neutered Shih Tzu named Tucker. And Tucker is here because he's got red eyes. It's both eyes. The owner said it started with one and then became both. He's got just sort of some redness. He's got a little bit of goopiness. He's got some like matted fur, around his eyes, so you can tell. He's been having this sort of discharge. And sometimes, according to the owner, he squints. But I'm not seeing, hardcore squinting right now. This apparently started just about 2 months ago. That's the history that I'm looking at. And so I'm looking at this little dog. Let's just start at the beginning. 2 months ago, the owner thinks she might have poked him. She said she thought she poked him in the eye at first. She also says they have a swimming pool, and he gets into the swimming pool, and so she thinks maybe the swimming pool has something to do with it. So all of those things are going on.
Wow.
Yeah, I know, it's a lot.
Got to filter through.
Help me sort this out and get down to what really matters here so I can get some kind of understanding of what the underlying process probably is.
I mean, this is a great case. I feel like it's something that is at least common for me to see, which I hope means it's common for general practitioners to see too, which are these red kind of nondescript eye symptoms. So the good thing is that most people have everything they need to rule out those kind of quote unquote scary stuff in their own practice. And so I will start with your basic eye exam, Schirmer stain, and IOP. And I feel like I have heard that a lot of owners may not approve all of those diagnostics being done. So frankly, to get around that at my previous practice, we lumped them all together. This is the eye exam.
You're like, this is the workup, right?
This is the workup. This is what we need to do. And then we're trying to rule out these important things so that we are ruling out the scary stuff. So the Schirmer tear test, that's going to look at our tear production. The Shih Tzus are definitely a breed, any brachycephalic breed pretty much, but they're definitely a breed that can get an autoimmune dry eye. And that is going to be probably one of the easiest things that you could find because we have great treatment options for that are over 80% effective at controlling their clinical signs. Biggest thing about that is lifelong therapy for dry eye.
Are there certain breeds that you're just immediately looking for that in?
Pretty much any brachycephalic or small breed dog. If I'm looking at large breed dogs.
Oh, yeah, okay. A pretty wide swath here.
Wide swath because all of them can potentially do it. But I would be less likely to think of dry eye as my number one differential for a lab that comes in unless they have a history of TMS, like sulfa drug use, type of thing. But so if we've done our Schirmers, and guess what? Our Schirmers is, on this case, we'll say 16. So still pretty normal. And you're like, okay, so now we go to our next one. And so we're going to do a fluorescein stain. to look to make sure there's not a particular ulcer. Now, it would be a little interesting to have ulcers in both eyes, but that is 100% something that I see. A lot of times with these bug-eyed dogs, they just stick their whole face into a bush. I had a Shih Tzu growing up myself, and he would just whole face right into a bush. So it's very possible that they could get poked in both eyes at the same time. So definitely stain both eyes, and you can, obviously we're looking for any type of stain uptake. And then the last thing that we'll do for diagnostically is our tonometry. And so that's going to look at our intraocular pressure. And really, that's probably one of the more urgent things to rule out is we're trying to rule out glaucoma, because glaucoma is one thing that can blind an animal within 24 to 48 hours in some cases, depending on how high the pressure gets. So that is an emergent thing. So if you don't have a tonometer in your practice, I highly urge you to get that, because it is the difference between saving vision for a while in an eye versus them being blind.
Talk to me a little bit about acute onset of glaucoma. So 24, 48 hours. I don't know that glaucoma pops into my mind as an emergency necessarily, like that type of rapid onset deterioration. How common is that? And then sort of what are the underlying mechanisms that make glaucoma? Oh, my dog got glaucoma yesterday, and today we have blindness.
Glaucoma is one of those conditions that I think is probably the most hated condition in ophthalmology, because we don't really know enough about it. There are a lot of different factors that predispose dogs to going blind sooner, and then other dogs they may have some protective mechanism that they can tolerate higher pressures for a longer period of time. It's very patient dependent when it comes to predicting how well these dogs will do. The other important thing for people to remember is that glaucoma in dogs is not the same as it is in humans. Humans, you can get diagnosed with glaucoma, go on treatment, and stay visual for decades. And in dogs, it is not like that whatsoever. But usually when they do present to us acutely, they have a red eye, there's vision changes, there's a blueness, like a blue discoloration to their eye, which is swelling or corneal edema. And a lot of times, frankly, that kind of gets blown off as a just normal red eye. Here we'll put you on empiric therapy for some type of inflammation, but a pressure was never taken because people don't think about it. And then they get sent to me because the red eye is still red, and then I diagnose glaucoma, and then I have to have the conversation with them about why this wasn't caught earlier. And a lot of times it's just because people aren't aware of it. And also there are many general practitioners that don't have the means to measure intraocular pressure. And so a lot of times that first eye, we're at an end stage by the time it gets to me, where it's blind and we're just going for comfort. And then we actually will then focus more on the right eye, because a lot of these dogs that present with glaucoma have a primary glaucoma, which means that they can get it in both eyes. So there's a lot of other things that can cause glaucoma too, but that's a more common thing that we see. So it can be fairly subtle in some cases where it is just a little bit of redness. And so that's why I think that checking tonometry for any red eye makes sense, because the downside of not checking is that if you miss a glaucoma diagnosis, that patient's going to lose vision.
So if you start to see redness in the eyes, that glaucoma is on your list and you're going to check a pressure.
Yes. And I will say some of that is for peace of mind. The other part of that is, I guess that would maybe say you don't have to do it every time, not to be confusing, is this particular case is that we're talking about is a Shih Tzu who's had a red eye for like 2 months. And so if you had a high pressure for 2 months, you will be blind pretty much, unless you're a cat, because cats do weird things. But with dogs, they would be blind. And so if you were prioritizing, maybe tonometry goes lower since it doesn't necessarily fit the signal.
What's your best little pearls and tips for getting good intraocular pressure readings? Because I know that people sort of struggle with that a little bit. There's definitely a little bit of art to the capturing of this values. Are there certain things that you see as best practices or little pearls that you think people find helpful?
Yes. So the biggest thing is less is more. So if I can have a dog just sitting there on the counter and I can just come up and do pressures without having to touch much of anything, that would be ideal. Now, of course, our patients move around and they don't want to sit still. So usually I want to make sure that there's no pressure on the neck and there's no pressure on the chest. And so that is really important. If you have an owner that is restraining, sometimes they're like really holding onto them. And we've seen in reports with cats that even just opening the eyelids and putting pressure on the orbital bones can significantly increase the pressure, like by a lot.
Oh, wow.
And so it's like I will just barely open those eyelids. I literally just need a small opening. I like the tonovet in particular because it has such a smaller footprint. You can kind of shoot it into smaller openings.
Okay.
Sometimes you do have to wrap them up, but it's always with the idea of less pressure, less pressure. And one of the pearls is if you have a brachycephalic dog or you have a dog that is moving around a lot more and you're getting a marginally high pressure, that's probably one I would recheck. I wouldn't necessarily just jump onto the glaucoma diagnosis and start therapy and doom and gloom, they're going to go blind sometime. But I would say, let's just recheck. So if you have that pug that's screaming and you get a 27, I'm going to say, okay, maybe we'll just give some sedative next time. So you can give gabapentin and trazodone and maybe recheck because those are not going to affect the IOP.
Yeah. That's a slick little move as well. Just if you know you're going to do it, go ahead and try to reduce that anxiety. So this little package totally makes sense. The Schirmer tear test, the fluorescein stain, and the IOP check. And so with our little guy, we decided that the Schirmer test was going to be normal. You didn't expect glaucoma because of the 2 months onset here. No evidence of a corneal ulcer. I'm kind of stuck here, Alex. Like, we kind of ran our base. I'm glad you did this. This is kind of where I start to go, oh boy, my bag of tricks is kind of empty here. Yeah. Where do we go from here?
From here, we start looking at any structural abnormalities. So did we have some type of trichiasis, entropion, stichia, or ectopic cilia that could be there? Now, the big thing about those that makes them all very unlikely in this case is how old this dog is. Okay. So if this dog were 1 to 2 years old, I'd be thinking about those a whole lot more. Since we're 9, we should be good to go since that's not been a problem for the last 9 years. We've ruled all that stuff out. We're really left with things that respond to steroids. Is pretty much what we're left with. And okay. I say it that way because there are autoimmune conditions. There's something called episcleritis. There is nodular granulomatous episclerokeratitis. So that's NGEK. And those are all just descriptor words. They're not really a diagnosis per se. It's just like what's happening in the tissue. And those are usually autoimmune and typically will respond to steroids. You also have allergies. So, I mean, I'm in Georgia. You're in South Carolina. There are allergies everywhere abounding. Yeah. And so that is one thing that I will be very honest with the clients and say, the good thing is that I don't see anything super scary that's happening.
Okay. I like this.
But there is something happening. It is red. There's some inflammation. And what we're going to do is we're going to have to use our therapies as our diagnostics to see what path we're going to have to go down. So if I'm starting a topical steroid for 2 weeks, like on taper dose, and then the redness stays away, then it's probably something like allergy related. Okay. If it is like twice a day steroid doesn't touch it, then I'm like, ooh, allergies usually respond to that. So maybe we're dealing more with an episcleritis, other autoimmune disease, and we need to ramp up our steroid therapy. And then we try and taper that once everything's, hopefully we can get things controlled. And then we'll use that to say, oh, well, now they're flaring back up. So there's this cycle, this process that's happening over and over again. And so we will need to do long-term anti-inflammatory therapy, usually not with steroids long-term, but we can switch them over to immunomodulators like Optimmune, cyclosporin, and tacrolimus. We will use their response and how they respond as we wean things down to guide us. So we may not get like the diagnosis, but we will hopefully get a better idea if we're dealing with something probably autoimmune or allergy.
Is there any value in routine blood work in this case? Are you going to see anything in the CBC that's going to give you an indication of autoimmune or anything like that?
Things like Ehrlichia. So Ehrlichia has been associated with episcleritis and a redness to the eye. So I feel like most of my patients are on preventatives already, and they have been forever. So it is unlikely for those things to happen, but there are definitely cases where things are not getting better, and I'm going to try a trial of doxycycline just to see if that makes a significant difference. I do like a 40X test in those cases, but I don't do like a really extended tick panels just because they're expensive for one, and most animals tolerate doxycycline okay. And so if we're doing a trial, I don't like to use antibiotics obviously indiscriminately, but if it's the choice between doing a $400 test versus here's your $10 of doxycycline, a lot of owners, I give them the option, but they're going to pick.
Yeah. That. What would you say to this lady about her swimming pool?
So it's funny because that's not an uncommon thing. Well, they'll fall into the pool
Yeah.
and then or something, just in general, something happens and now they're paying attention.
Yeah.
And now, so they're like, oh, this has just happened. And I'll say the corneal blood vessels that are present indicate that this has been going on for a very long time. And I think something drew your attention to it and then you started noticing, especially with Shih Tzus or any long-haired dog, their eyes are hidden a lot of the time and dark, and so they can't see some of those changes right when they happen.
Yeah. I feel like we've got a pretty good path now to start to sort these things out, to go along, to run my baseline diagnostics and start to separate out, and even get into some therapies. And I do like the therapy as diagnostics, and that's a nice way to sort of approach these things. Is there anything I need to be looking out for where this is going to go off the rails? Is there any chance that I've done a good job, I do not find corneal ulcers in this dog, things like that? We're going to go ahead and we're going to start steroid treatments to sort of see if this is allergies or stuff like that. Are there any big things I should put into their mind, red flags they should look out for, or reasons that they should call me right away? Anything like that I should make sure to call attention to?
Yeah, I think anytime I start a steroid, I'm always, honestly, I guess any therapy. Anytime I start a therapy, I give them what they should expect. We're starting this steroid. If it's not getting better in some way in the next 7 to 14 days, so 1 to 2 weeks, then we may need to reevaluate. If you think it's getting worse on this therapy, then please don't wait. And please come in earlier so we can get to the bottom of it. And so it's setting out that plan, which I feel like some referrals that I get, the owners don't know what the plan is and where things when they should have checked in and changed, some things should have changed therapeutically and they lost. And so I try to just lay all that out. We're going to check in here. If that doesn't work, we're going to do this. And if that doesn't work, we're going to try this, and just lay out A, B, C, and D for our plans, just to provide some direction. And also I write all that down for myself so that I can remember what I'm talking about and what my plan will be. Or if I see somebody else next time, that they know the direction that we were trying to go.
Well, what's your general sort of recheck schedule for things like this, Alex? Do you let them go for 2 weeks? Eyes always make me nervous, and I feel like I always say the great thing about eyes is they can get better really fast, but they can also get bad really fast, and so we're going to keep a close eye on them. Yeah, how do you think about that?
It definitely depends on the condition. Think of this particular case of redness where we've ruled out everything else, then I will leave it to the owner and say, hey, I need you to monitor for these specific changes. I need there to be less redness, less goopiness, no squinting. If you're seeing any of that getting worse, you're going to come in earlier, but I'm going to give you about 2 weeks before we recheck to see. And that's how I do most of my autoimmune therapies, whether it's oral or topical steroids, is about a 2-week interval in between the rechecks.
That makes sense. Great. Good. Is there any other last words of advice that you have for me before I head off to talk to our Shih Tzu owner?
One thing you did not hear me say when it came to this red eye was treating with Neopolybac.
Okay.
Bacterial conjunctivitis is uncommon in dogs. It is more common in cats because they can get chlamydia and mycoplasma, but dogs don't really get bacterial conjunctivitis. They can have bacteria present that is like an opportunistic thing from dry eye, let's say. But if you treat, I'm very big on less is more when it comes to therapy. So I'm going to treat the foundation of the issue. So if I have a dry eye case, I'm going to treat them for dry eye. I'm going to not risk using a steroid if I don't have to. Because once that dry eye is under control, all of that will be washed away, and we don't actually have to address that.
Okay.
So I just see a lot of cases that come in on, well, we tried Neopolybac and it didn't do anything, and you're like, yes, because the issue is dry eye, or glaucoma. Again, if we're going back to antibiotic stewardship, then I try to minimize the use of that, and I will only use really a topical antibiotic, I feel like, for corneal ulcer.
That's great. That's really good to hear. I love that every time we talk, you bring up bacterial stewardship. And I just think that that's such an important message. And it's a good reminder for me. These are things we always try to know more and do better year after year in medicine. And there's the old saying about like only half of what we know in medicine is right. We just don't know which half. And so anyway, I love this perspective. And it's definitely something that I want to incorporate into how I'm practicing. So Alex, thank you so much for being here. You have a phenomenal online presence. Where can people find you?
You can find me on Instagram. I am the Vet Eye Guy, and I have little snippet videos about various conditions and some fun stuff on there too.
Excellent. Thanks so much for being here, Alex. Guys, thanks for tuning in, everybody, and listening. Take care of yourselves, gang.
Thank y'all.
And that's what we got. Guys, thanks so much for being here. Thanks to Dr. Alex Sigmund for being here. I am going to go and sing "You My Red-Eyed Dog" to my dog and to my wife until she makes me stop. And so that's what I'm going to go and do. Take care of yourselves, everybody. I'll talk to you later. Bye.